We are already preparing for a big decision that could happen as early as next week that will affect every American.
News Channel 9 will have complete coverage whenever the Supreme Court rules on the Affordable Care Act or health care reform. And as News Channel 9's Kevin Sims found out today, some are already talking about what might happen.
I'm hearing that it's not going to be struck down.
Perhaps more than most people, Rick Mathis is closely watching the court's decision on health care. He is the director of research at the Ochs Center. His current interest, looking at whether rural hospitals are ready for the health care mandate that goes into effect in the year 2014.
If you've got a physician that may be already booked with patients and now there are more people that have insurance and are going to be knocking at the door, can they handle that?
The simple answer so far is no. Those smaller hospitals don't have the space or resources now, let alone if every American is covered. The study is to help Blue Cross Blue Shield of Tennessee prepare for the change. Mathis believes at least part of the law will stand.
For example, they may be able to rule against the individual mandate but leave the rest of the reform intact.
That does not mean, though, all his hard work is thrown out. Insurance companies are still interested in overcrowding. But it does mean the study might need to be tweaked.
There's something in between that people are looking for, and it's just really hard to figure out what that is and how we're going to get there.
Of course, like the rest of us, he'll have to wait to find out. Kevin Sims, News Channel 9.
And regardless of the decision, Mathis doesn't expect the debate to end. If it's struck down, look for appeals. If it's upheld, watch for Republicans to make it a major campaign issue. And even if the Supreme Court strikes down the Affordable Health Care Act, commonly known to some as Obamacare, parts of it will be with us in some form well into the foreseeable future. One constitutional law professor says it would take years to undo what's already in place. Things like the expanded medical coverage for adult children until the age of 26. Also in place, insurers are prohibited from a past practice of limiting how much is paid out in essential medical services over a person's lifetime.
This is such a huge issue. And I mean, forgetting how acrimonious it's become politically, I mean, it's going to take, 5 or 10 years to straighten this thing out.
But most economists agree that something needs to be done about rising health care costs. In fact, a recent Gallup poll found that a majority of Americans who oppose Obamacare would want Congress to create something in its place if the Supreme Court strikes it down.